First, I invite you to join me in an RBQT. Sit in a nice comfortable position with your eyes closed. Place your left hand over your heart and see if you can detect the heartbeat with the palm of your hand. Now put your right hand over your left hand and in your own time exhale normally through the mouth, inhale normally through the nose, and then make a full and complete exhale through the mouth, all the way. And relax. Let your hands drop down and go inwards for a few seconds. Observe yourself. Have you any aches or pains? Do you have any thoughts? Just observe them for a few moments. When you're ready, slowly open your eyes and return to the presentation. Before we start, let's do a brief review of some key points we've already covered. So prepare to pause the video after each question and answer for yourself. And when you're ready, restart the video to hear my answers. What is homeostasis? The Health, Disease and Adaptation presentation defined homeostasis as a state of biological balance, a dynamic equilibrium, something that maintains balance by constantly changing and evolving. What are the three key regulatory systems of the body? The first is the central nervous system. We connect with this through the skin when applying our devices. We can also impact the endocrine system, the chemical-based hormonal system, which is itself connected to the central nervous system. The CNS also produces neuropeptides, the body's natural healing pharmacy. We also covered that the central nervous system is divided into two parts: sympathetic, which manages the daytime responses of fight or flight, and the parasympathetic, connected to healing, repair, and regeneration. The first presentation also explained that the whole body is wired up as a light-based internet, in which the DNA itself produces light, which is transmitted around the body perfectly without loss. What are your insights into disease as a cycle of illness? Disease has to complete a cycle, which is all about adaptation. So the better we can support adaptation, the better the body can adapt, and the less profound the symptoms of disease, and the quicker it passes through the system. So on that basis, adaptation is all about communication, and our devices facilitate that. They also provide energy the body recognizes and can use for its own healing processes. And what are your insights into chronic illness and remission? All disease needs to complete a cycle, and in some cases the process becomes disrupted. When the cycle fails to complete, we may get a period of remission, in which case our perception can be that the illness has gone away. But that's not so. It simply means that the body lacks the coherence or the energy to complete the cycle of healing, and even worse, to raise the symptoms. So if we apply our technology in a state of remission, it will wake up the body, and then it will produce all of the symptoms associated with the disease.
In 2019, when I turned 61, I started having issues with my eyes. First, I noticed these strange prisms would show up, and I looked up, and it's called an ocular migraine, and I'd see those every once in a while. They'd come and go. And then I started getting flashes of light that I was really worried about. So then I went to my eye doctor and had my eyes examined, and he explained that as you age, the gel in your eyes shrink up and it can make tears in your retina, and that's what causes these flashes of light. And that's very normal. So in 2019, this is my eyes, my right, my left eye, and my left eye had been 20/40 for many years. There's the pressure, 17. And other than that, my eyes are pretty good. But then in March 2020, I bought my ENS, and I started using that. A lot of times I'd put it right on my neck, and I could actually feel my eyes improving. And I was noticing I could see better. And then in February 2022, I had my eyes checked again. I didn't have any more floaters, or I wasn't seeing any more prisms or flashes of light. And look, my eyes are perfect. And this is a few years later, 2022. The pressure is better, and my eyes feel great. No macular degeneration, which is very normal for older people. And I'm very happy that I bought this little unit, because I don't have any pain anywhere, and I have a general well-being, feeling of well-being. It's really great. I'm very happy.
So let's now look at some of the healing effects and at regeneration in action. This is someone with a very serious arm burn. The beauty of using these kinds of technologies is that we can take people out of pain straight away and end up with no scarring, and in record time. And that is the sign of regeneration, because this is a 3rd-degree burn, and the whole process took only 6 weeks. Imagine that. Imagine the amount of pain involved with this in most situations, and being able to deal with that alone, avoiding constant screaming pain and having to take painkillers, or having an open wound subject to severe risk of infection. Here is a young boy who smashed his front teeth, and this is a few days later. This is a sports injury. The top left image shows the eye is completely closed, and bottom right, after 20 minutes, the eye is now able to open a little bit, an amazing reduction in swelling in such a short period. In this one, we see images of an 83-year-old lady, an explosive wound on the back of her left calf. This was being treated by the low-level laser, and the search goes on for a low-level laser that will work extremely well with the ENS and associated technologies. As you know, the one we used to use has been banned. However, it was very low-powered, and it worked extremely well in association with our equipment. One of the things most people don't appreciate is that if you overtreat with the laser, it's like the treatment is undone. I can only speculate about how this happens, but if you consider that if someone has a 10 out of 10 pain, and at some point in the treatment it goes down to 0 and they forget about it, and then it all comes back again very suddenly, the pain can feel even worse than when it started. This is because the calibration point is different in every case, and this is important to understand. Another implication is that if we're combining this with a gentle, deep, resonant, regenerative mode in the form of ENS or cosmetic, then if we apply too much laser, we may undo the effect of the devices. But if we can combine them correctly, then we end up with much better, much faster results, because we're combining two very different regenerative technologies, one working with the central nervous system, the other working with the cells and the central nervous system. So this was a Q laser used on an explosive wound. I believe the doctor was probably being optimistic when he said he'd expect this to take up to a year to heal. With an 83-year-old, I can see that taking years to heal, if ever. The doctor was naturally concerned about the likelihood of infection and cautioned the mother-in-law to expect a divot in the calf after the wound healed. So this is pure laser, treating the wound on a daily basis, and the results were tremendous. No infection, no divot, and a total healing time of just over 4 months. My expectation is that if this has been combined with Cosmodic or ENS, it would have been even quicker than that, and overall we'd have an even better result. And if we think that these are only a placebo effect, then the first measurement we need to consider is the number of healing effects that we get as a percentage, because the placebo effect occurs in about 30% of cases. So, when given a sugar pill, 30% of people manifest healing. This is a self-healing process, effectively stimulated by what neurolinguistic programming practitioners would call suggestion. However, we have other theories, including quantum theory, coming into this area, and probably deeper insights and better explanations. Placebo effects can't happen on animals, and these technologies have been extensively used on animals as well. Here is some evidence. We have cases of racehorses that were due to be put down, that ended up not just being rehabilitated, but racing again and even winning the next season. Here is the visual evidence showing the scale of the injury, and the scarring came right down the leg, so there is damage all over the area. What is particularly interesting to note is the main scar shrinkage and the hair regrowth around the edges. When scars disappear, it indicates regeneration. So this is the progress on the horse, and obviously the healing is going very well, but not yet completed because the scar isn't completely gone at this stage. Here is a spider bite from a brown recluse, one of the world's most poisonous spiders. This kind of bite can cause necrosis, which is the destruction of skin and nerves we see here. My research indicates that there is no recognized good treatment for this, and it can take months or years to heal. Ultimately, serious cases can lead to surgical removal of necrotic skin, amputations, and potentially death if the issue goes systemic. Here is an example of osteomyelitis of the shoulder of a 1-year-old child. As we see, this infection is the start of a destructive process of the bone. We should see a nice round cap on top of that bone, and it's been destroyed by the infection. What we see is lysis of the capitellum. The round part of the top of the bone is completely gone, yet the child has a full range of motion. This leads us back to energy healing theory, which is that the energetic form comes first and last, as we see in the effect where pieces of leaves have been cut off, yet the energetic projection of the whole leaf remains. So this is not at all what we'd expect. How can an arm move if it doesn't have the top of the bone there? We see the progression of the initial fragment formation of the new bone growth now, and again full functional activity. The bone is regrowing. This is now 2 years and 1 month. The bone nucleus is grown and firmed, but not complete, so it's a long process. But my thoughts are, again, with the right combination of technologies, it can probably happen much faster. And now we can see the complete functional and structural, yet partial anatomical restoration on the X-ray. And then the completion on the right side. So how much is a bone worth? A lot, to anyone. As a reminder, this was total destruction of the capitellum, and yet full range of motion. How does it happen? This way. The Russians used Kirlian photography to record the energetic projections of things like leaves. What you're seeing here is a leaf that has been cut, yet the energetic form remains intact. We also know that the energetic form comes first from the experiments we covered in the first presentation regarding flatworms. The regenerative process is driven by cellular communication, not DNA. So if we're treating a back with an injury, then with the right energy and information, the body is able to move it back into its correct energetic form. This is what happens naturally, but with our equipment, we know it can happen much more quickly. We can enhance the results by using the reset breath and quiet touch, and we usually use that with something called the Triad wave from Brenda Williams. We can think of the Triad wave as an interwoven set of 3 natural frequencies used to support the body's natural healing effects. We can get music with the Triad wave embedded from Steve Scudler. There is information in your Keep Health Mastery workbook on this. It's the price of normal music, and you can play it silently through a phone or computer because the frequencies are subacoustic. So when we use the Triad wave with our devices, we get the patient to do the reset breath and quiet touch, or RBQT, as we do at the start of all the videos. The RBQT helps the client to move immediately into a deeply relaxed parasympathetic response, opening up the healing and regenerative capacity of the body. The Triad wave frequencies act as an energetic platform or field for the cells of the body and the energy system itself to rest upon. In addition, the energy treatments themselves ride upon these waves. And in the process, we take people very quickly out of this sympathetic nervous system responses of stress and fight or flight, which we all know are not conducive to healing. I want to share an example of using this myself. I was using bioresonance diagnostics technology for the first time. And that technology sends subacoustic signals into the body through headphones and handheld electrodes. The technology uses resonating frequencies it detects from the body to create a visual representation of viruses, bacteria, parasites and fungi and other issues. Typically, the therapist selects the most important item and pushes a button on the software to get that treated, like an opera singer hitting a note and shattering a glass. Normally this works very quickly, but in this case, it didn't work. They pushed the button half a dozen times and nothing was happening. Then I remembered the reset breath and quiet touch and the Triad wave. So I played it on my phone, did an RBQT, the therapist pushed the button one more time, and the problem was resolved immediately.
I just maybe just like to clarify that I'm not a practicing clinician, even though I've been using the soft laser and the ENS device mostly on myself and those who are curious or willing to try a different healing approach. So over time, I've got a couple of really good examples I'd like to share. One of the things that really stood out to me, which was a remarkable incident, was an elderly friend of mine in long-term care. She had a hand caught in the bathroom door. When I got to see her the next day, her hand had already turned purple and blue. So luckily there weren't any fractures or broken bones. I started out using just the ENS device, but I changed it up, between different modes, and I just monitored her reaction. Mm-hmm. Then after about an hour, honestly, if I didn't see it with my own eyes, the dark blue and purple, the bruising almost all went away. I was so chuffed with this process that I called the nurse over to come have a look, and she was even more surprised. Yeah. She couldn't believe it either. And then, she started calling the healthcare staff in to come and have a look. And that's when they started lining up and asked for a little assistance, with their own ailments. Yeah. But that to me was a remarkable, unforgettable experience. One of our dogs, she had a sore on her lower leg just for the longest time. It didn't seem to bother her. I mean, she was just like hair would grow over it and she would walk and run just fine. There were no visible signs of limping. There was no swelling. There was no pain. She wasn't licking the sore or anything, but it looked like it was just a sore. Went to the vet, and the vet gave us some cortisone ointment. It really didn't seem to make a difference at all, and the sore just kept on persisting. I then decided, okay, why not try the ENS device? I put it on A1. I used Scenar cosmetic initially, but then I also lowered the energy level. And I used those small flat shungite plates at the bottom of her paws, because the only place I could get traction without hair on it. Thank goodness she's a very patient and gentle girl. And short from a miracle, that sore healed up completely. I would say it was after about 3 treatments, all in all. So much so that now you can't even tell which leg the sore was on. But now I use this soft laser. I use it for about 3 cycles, just as a maintenance routine treatment. So every 2 weeks for each of the elderly dogs, just using it alongside the spine and on the hips. I can use the ENS device probably, and I'm excited on using it for the application on animals, because with age comes arthritis, and living up with severe cold temperatures, it's not your friend. So I must say, what we did notice overall, the dogs seem to be much happier and healthier. So.
And how quickly did you get a result with that one, Roche?
After the first treatment, it seemed to like more hair started coming back in about, I would say, about a week or 2's time. Yeah. And then I thought, well, give it another go. Yeah. And I must have used it for about 3 treatments. I was super surprised. I didn't think anything was going to make a difference at all. And again, like I say, unless you see it with your own eyes, it's like people tell you, but unless you see it, it's just amazing. The results, it's a very powerful device. Got another example, sort of more closer to home. So my elderly mom had, along with her roommate, now they're both in frail care. And, aside from supplements and using some alternative medicine, like elderberry syrup, for example, to help alleviate the symptoms, I was fortunate. All just happened at the same time that I received the Solaris blanket just in time. I took the blanket into her, and when I compared her healing progress to that of her roommate, now they both got sick at the same time. They're both around the same age, yeah, and are relatively healthy, both of them. They don't really have any severe underlying conditions and stuff. She recuperated much faster. To this day, she still uses the blanket, but as a sort of a bedspread. Yeah. I believe it's not only improved her quality of sleep, but just a general overall well-being. Then, Mike, just maybe on a personal note, I got a bit of a toothache a little while ago, and then I thought, bloody hell, not only am I not very fond of dentists, but I just don't have the time in my schedule to go. So I thought I'd give the ENS a try at it and see how that goes. And I always do 6-7-point protocol. And then what I did is I just placed the sliders on my skin, and I allowed the device to seek out, whereabouts the exact nerve ending was that was linked, kind of to the bang that I felt in my tooth. And it picked up on it soon enough, and then it kind of felt like it homed in on it. Once it dosed on that spot, then I switched it to Scenar ENS, and I allowed it to dose again. I would say all in all about 10 minutes at a time. I've been doing it every time I felt the bang, which became less and less over the last few weeks, I have to say. And I don't think I'm going to have to be going to the dentist or worry about that anymore. It's kind of really kept it at, I don't know what it's done, but it's kind of going away. So most of the quick wins for me, and obviously for the other person too, center around like things like muscular or joint injuries. So things like carpal tunnel, tennis elbow, tendinitis, arthritis, or rotator cuff issues. These I found are pretty quick and easy to treat.
Yeah.
Within about 20 minutes. Oftentimes the results are felt almost immediately.
Yes.
And people just, I don't know, it's just a spurious reaction. They get up, they bounce around, they stretch themselves out and say, oh, this feels much better. I've got sort of like the increased mobility and extended range of motion. And they just, spontaneously start, expressing, they're feeling better. Yeah. Or they just sometimes just describe them. Overall, I've got this feeling of lightness and relief. But I can tell you, Mike, really, both the soft laser, the Solaris blanket, all the stuff I've been using, it's just, these devices are very intelligent. And I feel that they're, in a sense, very intuitive. They're very sophisticated, very powerful instruments. And I'm really excited when I think, and I believe that frequency is truly going to be the next field in medicine. It's going to be the final future that is here that we can now embrace and we can go forward. So I'm super excited that, I have these devices and I can not only help myself and friends and family, but I can help so many people that word of mouth just traveling, and it's just for the smallest bit, and it's that quick win. I use it every day. I feel the difference. I feel out of sorts if I haven't used it for the day, even if it's just for the energy cleanse or a 6-7 point. It just feels good, and I feel like I can never overuse it on myself. But it's it's not just like for me with rotator cuff, I wouldn't know the exact same spot, and I would just put the device on the rotator cuff, and it's as if the body recognizes. The device sends out the healing frequency, and even if you don't understand the exact anatomy and where exactly to put it, I find that my body recognizes what it needs to take.
Yes. And
it sort of homes itself right in on it, and then I feel it's starting to work on its own.
My introduction to Scenar came through a meeting with a businessman who explained to me that he had a serious back problem the week before and had literally been bent double. Unable to work or to drive, he'd asked his secretary to drive him to a Scenar therapist, and after a few minutes of brushing his arm with a Scenar, which was a first-generation device, he was invited to straighten up because the issue had been dealt with. The secretary burst out laughing and said you should have seen the look on his face. Absolute amazement. That from literally being bent double, he could suddenly straighten up, with no pain. A few years later, I was visiting Liverpool after I'd bought my own Scenar, and I had my own back problem. There was a noise which was about the loudest click you can make with your fingers, so loud that my cousin over the other side of the room said, "What was that?" And I managed to gasp out, "That was my back." I immediately used the first generation Scenar, using pads, and treated on full power, using a wave FM mode for 20 minutes. As soon as the Scenar was connected to my back, there was no pain. 20 minutes later, I removed the pads and I was pain-free for the rest of the day. This happened in the morning, and that night I had a sharp needle-like pain in my back again. So I used the Scenar again, treating for a further 20 minutes. I did exactly the same thing the following day, treating for 20 minutes in the morning and 20 minutes at night. The day afterwards I had to carry a military Bergen rucksack and day sack. I was carrying 23 kilos in the Bergen and another 20 kilos or so in the day sack, so 45 kilos or 100 pounds 2 days after a serious back injury. That kind of injury would normally confine someone to bed for at least a week. During the same visit, I met up with someone who introduced me to a group of his friends and asked if I could give him a neck and shoulder massage with the Scenar. We call this the little wings technique. As I did so, one of his friends asked what I was doing, so I said it was a piece of technology from the Russian space medical program, and he almost pushed his friend aside, wanting to be treated with it. He didn't tell me anything about a problem, so I gave him a quick arm brushing, which usually lasts around 8 to 10 minutes. During the treatment, he started to get very excited, touching his leg. As it was being disruptive, I asked him to calm down and said, just let's complete the treatment and then we can talk about it. Afterwards, I asked what was going on then, and he said, I can feel my leg again. So I said, okay, how did it feel before? And he said, numb and tingly. I said, do you know why it felt numb and tingly? And he said, yes, I broke my back. So I asked, when did you break your back? And he responded, 26 years ago. So I said, you mean to say that you feel your leg properly for the first time in 26 years, after about 8 minutes of treatment with this device? And he said, yes. And I can't wait to go home to jump in the bath tonight, because every time I jumped in the bath for the last 26 years, I had a very sharp electric shock in my leg, and I'm sure it won't happen again now. I never met him again, as often happens, but I spoke to his friend a year or two ago and asked after the friend of his, and he said, yes, it was resolved in less than 10 minutes, a problem that had been with him for most of 30 years. I've seen many examples like this. I was in Norway for a few months, and there was a woman who lived over the road from me who kept on complaining of serious back problems. So serious, she hadn't been able to work for 10 years. I kept offering to treat her, and eventually she was persuaded to accept a treatment from me, though she wouldn't agree the course of treatment that I recommended. The quick version is that she was treated probably about 6 or 7 times over a month, and at the end of that period she was back working for the first time in 10 years. She was so impressed she brought her mother to me. Her mother had a serious neck and shoulder issue after a sledging accident. I asked the mother, do you have any pain anywhere in your body? And she said yes. She was a Norwegian grandmother and a farmer's wife, so a tough lady. And I said, okay, give your pain a number out of 10. And she said 10. So I was quite surprised at that. I gave her 3 back-to-back treatments. One was the 6 points on the face with the first generation Scenar, which is a very quick process, typically under a minute. I then gave her an arm brushing to detect the nerve inflammation in her body, and that took approximately 8 or 9 minutes. And finally, I gave her a 5-minute neck and shoulder massage using probes. And then I said to her, do you have any pain anywhere in your body? And she said, no. And I said, 0? And she said, yes, 0. So I asked her, when was the last time you had no pain in your body? And she said, I can't remember. Years ago. In Austria, I got to treat an old lady who had leg ulcers, whose pain was so severe that she couldn't sleep at night. I was treating her with a Scenar cosmetic slider and with a laser, and after the first treatment she was able to sleep again, as the pain was enormously reduced. I gave her a course of treatment over a period of about 4 to 5 months, in which time the ulcers were completely healed. She informed me that she had friends who'd had ulcers for 10 years that have never healed. I always carry my device with me, and on a trip to Bali I was invited to treat someone, again with a first generation Scenar. They were so impressed they told about 6 people, and I had them all arrive the next day. One guy didn't tell me what the issue was, which is quite common, so I gave him the 6 points on the face. With the old device that was under a minute, and he suddenly said, stop, stop. I thought there was a problem, but he said, no, all my pain's gone. So this was after about 30 to 40 seconds of treatment. I said, okay, you didn't tell me you had any pain. You need to expect this with this technology. People very often test you and the equipment. So I asked, what was the problem? And he said, I put a rib out weight training yesterday and it's just popped back into place. I had a similar experience with my introduction to the Scenar, because when I met the therapist the first time, I was given a little neck and shoulder massage for a few minutes. I had no problems to speak of, and I was just invited to observe my body overnight. Then we met up for a cup of coffee the next morning. He said, okay, what was the reaction? I said, well, for the first time in several years I'm able to look at my watch and differentiate between 1 and 7 on the digital watch, so my eyesight has improved. I also had a short, sharp pain, literally for about half a second in my ribs. What do you think that might have been? He said, I don't know, it's your body. What happened to your ribs? And I said I broke them in a motorbike accident a few years ago. And he replied, well, I would think that's one of your ribs popping back into place. In Sweden, I invited a young woman to visit me who had a major problem with endometriosis, a chronic illness. She shook and went pale as she was telling me about experiencing 2 weeks of absolute agony every month, and she told me she'd been written off by the medical establishment. She tried everyone she could possibly speak to, consultants and specialists in endometriosis. I taught her and her boyfriend how to use the technology, which by this stage was a Scenar, a cosmetic, a laser and a healing blanket. She had a very intensive course of treatment for a week, and I told her, you must continue with the therapy until the symptoms are completely gone. Unfortunately, she had to go home, and she ignored my advice with regards to the follow-up. But the first thing she told me was that in the following 2 weeks after treatment, she had no 2-week period of agony. She had 4 days of nausea instead. However, gradually, over the period of a year or so, the symptoms of the endometriosis started to come back. And at that stage, the solution for her was to buy her own equipment and treat herself, and that's exactly what she did. The issue is that when we start to make momentum with one of these illnesses, we absolutely must drive it home and get rid of it as quickly as possible and completely. If not, the body has a chance to build up tolerance, and that means we're into a longer, slower process, and possibly a process that may not be completed. So this is absolutely critical to remember. When we have an illness on the run, we drive it home until it's completed, so none of the symptoms reappear. I trained a UK clinic a couple of years ago, and there was a new patient there who had fibromyalgia, a lady who was in her late 30s who had a couple of young children. We designed a course of treatment for her. Again, she'd been written off by the medical establishment, and she reported amazing results within about 17 days of the start of the ENS treatment, and it was quite clear that this was going to be cleared up within probably 6 weeks, so a stunning success. At the same time, I taught the owner cosmetology, which means non-invasive facelifts. In that process, we normally treat one side of the face and we ask them to look in the mirror and compare for themselves. This was the first time I'd done cosmetology. I treated the lady, and that was about 20 to 25 minutes on one half of the face. She looked in the mirror and gasped, and her words were, "The wrinkles on the side of my face are half or less than half the size of the wrinkles on the other side of my face." So it's very important that we get people to calibrate and reflect and actually see the progress for themselves. When we're treating things with the Scenar, we often find that when we recalibrate with the patient, "Okay, I'm finished now. Do you have any pain anywhere in your body?" There's a look of confusion and surprise on their face because they've completely forgotten about the pain. This also means we need to be careful about exactly what we say and how we do the calibration approach. We want the start and the end of the treatment to be calibrated completely neutrally, and we'll go into this later. So those are just a few of probably 800 or 900 treatments that I performed on people with a very high success rate. In fact, I'm surprised if I don't get a major result straight away. If I don't, it always raises a question for me as to what's going on there. Maybe there's something deeper going on, and the intelligence of the body is using that energy for not a knee problem, for example, but on something much more significant.
Hello, my name is David, and I got my ENS machine about 3 to 4 weeks ago. I wanted just to share with you the very first experience that I had of using the machine. I had to go around to pick something up from one of my neighbours, and when I knocked on the door, she came to the door, almost bent over double in pain. She thought she'd turned over in bed and tweaked something, and it was a real painful spot on her back, which was causing her a lot of mobility issues. So I told her that I had this new machine and wanted to test it out on someone, and would she act as my guinea pig for that? So she said yes, and she popped round the very next day. And I did some simple brushing techniques on the point of pain. We got some asymmetries up. I dosed the smallest of those. That took probably about 6 minutes, and I thought I'd go for the second dose as well, double dose. That came in probably around about 30 to 35 minutes. I left it there and she made her way home. She said she felt a little bit better on the way home. It wasn't that far, of course, but I caught up with her the very next day and she was absolutely amazed with the change. She said that her pain level of about 9 out of 10 had gone down to about 3 or 4. And could she have some more treatment? So I said, yeah, absolutely. I saw her a couple of times more that week, and we did similar sort of things using different modes that the machine offers. And within a week, the pain had pretty much subsided down to a 1 out of 10. So I am absolutely amazed at the speed and efficiency of the ENS device. I'm a 7-year Scenar practitioner using a first-generation Scenar, albeit a very good model, which does exactly what it's supposed to do, but the ENS machines just opened my eyes to a wider range of possibilities. So very pleased to have got it, and I will continue to use it in my practice going forward.
Here is the laser. I was using this laser extensively with my baby daughter when she was teething, and after 10 seconds or so of the laser applied to the cheek, she was a completely different child. So the result was that she went through her whole teething process almost completely without pain. The moment we realised that she was in pain, we gave her a laser treatment, and that was it. It was a miraculous kind of result. When she was about 2 years of age, she got stung by a hornet, and by that stage she knew to ask for the laser. So I treated her for a few minutes over the site of the sting, and after 10 minutes she told us the pain was gone. I told some local people about this, and they were asking if it was swollen or inflamed afterwards, and the look on their faces was an absolute treat when I told them there was no inflammation at all. I treated the lady here for leg ulcers very successfully with the laser as well. There were 2 types of laser, the Q10 and the Q1000, which is the more powerful one. I also found 3 cycles of the Q1000, which is typically about 9 or 10 minutes in total, and I could turn off a headache, and the headache wouldn't come back again. There is lots of evidence on PubMed on the impact of lasers in terms of regeneration. I've also seen a video of a paralysed bear cub which was dragging its hindquarters, and after a few days of laser treatment, it was back up and running again without any problem. The laser is also excellent for pain and injuries. It produces extremely profound results, and in some cases we have some quite complicated issues to deal with. For example, I was treating one man in Sweden who had what appeared to be a lower back injury first of all. Then after the first treatment, the pain moved to a shoulder. I treated the shoulder, and the pain moved to the middle of his back. And then finally it went to the front of the chest over the heart. So I was alternating approaches and combining the laser with the Scenar and cosmetic. And after this pain jumping around all over his body, eventually he had a great big grin on his face when I asked him, "Do you have any pain in your body?" And he said, "No." So that shows us how pain can move in some cases, and it's really important that once we've got the pain on the run, we chase it. And if we do, we can have a fantastic result like that in one go. So this is what the client said. In this case, the client who had the fibromyalgia at the clinic in England. I think this is very powerful regarding how the technology works. Today, I'm experiencing the least pain in my body since being diagnosed with fibromyalgia 2.5 years ago. I've been writing a daily diary. This is day 17, and I've had 6 treatments to date. I've been noticing immediate pain relief after treatment in different parts of my body. Also, pain started to shift and move down my body, not something I've experienced before. I also noticed incredible improvement in my movement, and my body started to function better. Prior to the treatment, some mornings I could barely walk, and bending over was very, very difficult, often needing help to put my socks and shoes on. I can honestly say I've just had the best few days with my kids, as I started to feel like the old me again. I was told my pain would be with me forever. I felt at times like my life is over, with no hope whatsoever of any cure. I've changed diets, come off all medication, and take several very well-researched supplements, and I'm doing everything I possibly can to manage my condition. But at times, things have got so hard, I've wanted to give up. Today, I've woken up with full mobility and very little pain. I'm up, and music is on, dancing in my kitchen, laughing with my children, even cried happy tears. I feel hope for the first time since my diagnosis. Hope is everything when you've been told by doctors and specialist consultants that there is nothing they can offer you but more medications. To keep balance and realism here, I need to mention that in maybe 5 to 10% of cases, we do not get an immediate profound result. I'm so used to the equipment working brilliantly that this always surprises me, especially with problems involving pain. We will cover how we deal with this in later presentations. So, I'm not a doctor, and I don't diagnose or heal anything. I simply apply technologies to assist the body to heal itself. I understand the principles for using Scenar, Cosmotic and ENS, and how to apply them, and how to use them in combination with other technologies. And I use information and techniques to direct application as accurately as possible for the best and fastest results. Frankly, I'm interested in anything that supports the body in healing itself, including all regenerative technologies like the laser and HHO. I'm also interested in the role of diet and environmental factors that impact self-healing. And this is our focus on Keep Health Mastery. I encourage you to buy a small hardback notebook and invite patients to record the issue that they have, how much pain they've got, etc., how they reacted to the first treatment, and how the treatments work overall. Get it in writing at the time, ideally in their writing. Ask for regular progress reports, especially for chronic problems, because many of the things we're dealing with are not apparent on the surface. It's not like dealing with cuts and burns and things like that. As these issues are inside the body, the best evidence we can get is people's testimonials. So testimonials, even in the form of a line or paragraph, are very useful. Not all issues are easy to record and prove, so if you do have something which shows on the skin, whether you're doing cosmetology or something like that, photographs are the best option if you can get permission to take and use them. This is very important if you've got anything public facing and you need evidence to show what's happening. So let's see how well you recall 2 key points for this presentation. As before, please pause after each question and restart to hear my answers. So how are these devices universal healers? This one is simple. They stimulate adaptive responses by the body. And what is the difference between energy healing and regeneration? Energy healing is fast repair, and regeneration is undoing injury or illness as if it never happened in the first place, including issues like scarring. Thank you for watching.